Welcome to The Criminologist, the podcast dedicated to educating and entertaining our listeners. We bring you subject matter experts from around the world and share the latest and greatest evidence-based practices and interventions to help individuals desist from a life of crime and delinquency. We do so by painting an accurate picture of that journey from the perspective of the justice-involved individual. Too often, our perceptions of those individuals are tainted by media-driven caricatures created to sell newspapers or movie tickets. This adds little to a healthy dialogue as to how to best address criminality and the reintegration process. This podcast avoids stereotypes and biases in favor of the lived experiences of those we can best learn from. Now please, welcome the host of The Criminologist, Joseph Arvidsson.
Well, thank you, and welcome to episode 69 of the Criminologist podcast. Happy to have you all with us today. As promised, today we are kicking off a three-part series with the esteemed Dr. Jerrod Brown of Concordia University in St. Paul. Jerrod Brown, PhD, is a professor, trainer, researcher, and consultant with multiple years of experience teaching collegiate courses. Dr. Brown is currently an assistant professor, program director, and lead developer for the Master of Arts degree in Human Services with an emphasis in forensic behavioral health and a second emphasis area in trauma, resilience, and self-care strategies for Concordia University in St. Paul, Minnesota. In addition to the experience mentioned above, Jerrod has provided consultation services to a number of caregivers, professionals, and organizations pertaining to topics related to autism spectrum disorder, fetal alcohol spectrum disorder, confabulation, suggestibility, trauma, and other life adversities, traumatic brain injury, and youth fire setting. Jerrod has also conducted numerous trainings for professional and student audiences. Dr. Brown is also the founder and CEO of the American Institute for the Advancement of Forensic Studies, also known as ACES, and he's the editor-in-chief of Forensic Scholars Today. Jerrod has completed 4 separate master's degree programs and holds graduate certificates in autism spectrum disorder, other health disabilities, and traumatic brain injuries. Jerrod has published several articles and book chapters. Dr. Brown of Concordia University in St. Paul has graciously agreed to rejoin the Criminologist podcast for a special 3-part series. Recall Dr. Brown joined us back in episode 64 to share his diverse insights with us. Well, he's agreed to come back to tackle 3 topics over 3 episodes. And those all begin today with Jerrod talking all about ACEs, or Adverse Childhood Experiences. I am pleased to announce that he'll be back in the future to talk about trauma-informed care and also the final episode on resilience and self-care strategies for the helping professional. If you've not heard it, again, go back, listen to episode 64 with Dr. Brown. Please enjoy the first installment of this 3-part series as we learn all about ACEs from Dr. Jerrod Brown. And I will see you all on the other side. Welcome back to the show, Dr. Brown. For those listeners who were not fortunate enough to catch you back on your previous episode that you did for us, why don't we start off by you tell us just a little bit about yourself, generally speaking, maybe your background educationally and vocationally before we dive into some ACEs talk.
Absolutely. Thank you so much for having me back and to be able to talk about the topic of ACEs. So I am a professor at Concordia University in St. Paul, Minnesota. I'm the program director for the online Master of Arts degree in Human Services with an emphasis in forensic behavioral health. And next month in September, we'll be launching a new emphasis area that focuses on self-care and trauma and resilience, and we'll be digging into the topic of the adverse childhood experiences, trauma in general, and a whole bunch of other really important and complex topics. I have a PhD. I'm a professor, trainer, researcher, and consultant. I do a lot of work in the area of fetal alcohol spectrum disorder, autism, traumatic brain injuries. I do some work in the area of confabulation, suggestibility, youth fire setting. But I love learning about any topics that have relevance to the criminal justice, forensic behavioral health, and legal fields. I do quite a bit of work also in topics that I think probably some of your viewers may not have a lot of training in, but if you are working in the criminal justice, human service, social service arenas, mental health arenas, you definitely want to know about these topics. Some of these topics include executive function. It's really like the CEO of the brain. It drives the bus with behavior. Most people who are in prison, if they're dealing with a cognitive impairment, trauma histories, are probably dealing with some dysfunction in the area of executive function. Also do some work in the area of alexithymia. That's a topic I think most people have never even heard of. Alexithymia would be if you're working with a client, they don't have words to express their emotions. There's a disconnect between how they feel emotionally and how they express that. Very important topic to be aware of. We could talk all day about these topics. And one other topic I'll just briefly mention, and maybe, Joe, we can do some chatting about these topics in future podcasts, but it's something called theory of mind. Theory of mind relates to perspective taking. There are elements of empathy that are wrapped up into that. It's really, think about it in the sense that, does your client understand the internal mental states of other people? Thoughts, wants, needs, emotions. Why am I telling you about these topics? Because trauma has been shown to contribute to deficits in these areas. And if we look at this through a lens of, if you're an interviewer, probation officer, if you're doing a pre-sentence investigation, if you're a forensic evaluator, if you're a legal professional, if you're a human service worker and you interact with people, you're probably interacting with clients with trauma histories. And now you bring these other topics into the mix. This just complicates the interview, the screening, the assessment, the goal planning, the intervention process. It has significant implications, in my opinion, for sentencing if someone were to go to jail or prison or be put on like community supervision. All very, very important topics to consider.
Loyal listeners of the show, Jerrod, know that I come from a risk-need-responsivity background, but one of the reasons I love having professionals such as yourself and others really from all over the world on is to continue to promote a more holistic way of how helping professionals go about their business. Again, that risk-need-responsivity is a great framework to begin with, particularly if practitioners were just sort of freelancing. But now whether it's the emerging assistance models, trauma-informed care, you just mentioned theory of the mind, or even previously you talked about some of the considerations around brain chemistry, for lack of a better term. But again, I think it just behooves us to keep on looking at all these different approaches to better serve those at-risk populations that we serve. As I noted, today is the first of a 3-part series with Dr. Brown covering a variety of relevant and timely topics. Today, we're going to talk all about ACEs, or Adverse Childhood Experiences. Jerrod, let's start out giving our listeners just a broad overview of the history and current state of what we refer to as ACEs.
You bet. So maybe to back that up even just a little bit more, let's talk about trauma for a minute. Trauma is very widespread. If you're working in the helping professions, it's almost the rule rather than the exception that a high percentage of the clients that you work with probably have trauma histories. And it's not just clients. We need to consider, is it a witness to a crime? Is it a defendant? Maybe you're working with a family. So trauma can impact people on so many levels. Trauma can be emotionally overwhelming for an individual. It can be mentally overwhelming. So it's very common for people with extensive trauma histories to also be dealing with co-occurring mental health challenges, depression, anxiety, but it can also have a significant impact on our physical health. Sleep problems, very common among people with trauma histories. Digestive health issues. It can impact your energy, your thinking abilities, how you feel, how you behave, how you cope with future stressors, future traumas, and just how you interact on the job, with family, with friends. It has implications throughout the entire lifespan. It doesn't matter if you're older or younger. Trauma can have a really negative impact on functioning. So a lot of times when we think of trauma, I think what comes to mind for some is like physical abuse, sexual abuse, emotional, verbal abuse. Those would be more referred to as acts of commission. On the other side of that spectrum, these are all types of traumas. There's acts of omission. This could be physical, emotional, medical neglect. All of these things can really impact that individual's functioning on so many domains. But trauma can also be experienced through someone witnessing an event. So what happens if that child grew up in a home and witnessed caregivers abusing each other? Parental substance misuse, parental mental health issues. Maybe that child was exposed to neighborhood violence, poverty, homelessness. Maybe it was peer victimization at school. What about pet trauma? What about betrayal trauma? Maybe you felt betrayed by a loved one. So trauma, again, we could spend all day talking about trauma. But if we look through the lens of the adverse childhood experiences literature, if you're not familiar with the ACES research, the first study was published in 1998. And if you go to the Centers for Disease Control and Prevention and type in ACES study, they have a really nice page on there dedicated to the original study. And they also have some good videos on there, handouts, resources that talk about ACES and why this topic is so important. So what is ACEs? Think of it as traumatic events occurring to that person before the age of 18. In most of the cases, it really looks at younger kids. But basically, trauma can come in many forms. Trauma can contribute to really dangerous levels of stress. And when it reaches a dangerous level, it's called toxic stress. We'll talk about that in a few minutes when we talk about complex and developmental types of trauma. But trauma, dangerous levels of stress, chronic stressors that are uncontrollable to that child or teenager or adult can absolutely impact brain development, body development. Is very important too, and I don't want to get too far deep in the weeds on this topic, but trauma has been shown to contribute to chronic low-grade inflammation. Why should you care about that if you're a probation officer, a police officer, a lawyer? Because chronic low-grade inflammation is a driver in many diseases and disorders, physical and mental health disorders. But we also need to consider prenatal types of trauma exposure as well. And I'll talk about that today a little bit. But when we think about the different types of ACEs, this original study looked at household dysfunction, high conflict divorce, parental incarceration, child growing up in a home witnessing parents using drugs, alcohol, but also looking at neglect and then the various forms of abuse. So, and it branches out from there. But basically, when we think of the ACEs research, the higher number of traumas that person experienced early in life, and if they didn't have the right supports, services in place, there's a greater likelihood that that person grows up and has more challenges. There's tons of research on the long-term implications of ACEs, higher levels of major depressive disorder, increases in suicidal thinking, higher rates of post-traumatic stress disorder, increased incidence of drug and alcohol abuse. There's a huge connection between poor health outcomes, heart disease, cancer, chronic lung disease, increases in sexually transmitted diseases. We also need to be aware of intergenerational transmissions of abuse as well. What happens if mom or dad or grandma and grandpa had significant traumas? How can that get passed down the line genetically? It can contribute to social problems, increases in homelessness, criminal behavior, unemployment. It can contribute to parenting problems. It has a significant impact on emotional, behavioral health. When we think of health risk factors as well, there is a connection between higher ACEs scores and increased incidence of smoking, obesity, even living a sedentary lifestyle, low energy, fatigue. I mean, the list goes on. So this is why it's such an important topic for us to be aware of.
You mentioned there's a lot of correlations here between, ACEs and these other variety of issues. And at one point, I know you just mentioned involvement in the criminal justice system. So full disclosure, when I was first became aware of ACEs years ago, and again, when I was firmly entrenched within the risk-need-responsivity approach, one of the questions I had was, there's a lot of things on here that aren't necessarily criminogenic, or again, those things that strongly correlate to recidivism. Things like, you mentioned depression or health issues, things of that nature. What would you say, Jerrod, to a well-intentioned probation officer who embraces the risk-need-responsivity model, and they look at those ACEs correlates and say, yeah, but that's not what Joe trained me on when we were looking at these traditional criminogenic risk assessments? How do those two approaches sort of play nice in the sandbox together, or where do they fit into the case management approach there?
I'm going to keep this to about a 10-hour discussion, so bear with me. So when we think of trauma in the criminal justice system, and you're working with clients on probation, parole, coming out of prison, there's many ways in which people can experience trauma. Animal abuse, child growing up in a home witnessing a parent abusing an animal, arson, child abuse. What happens if it's a young child growing up in a home and they were exposed to pornography growing up? Drug abuse, gang-related activity, hate crimes, human trafficking, stalking. I mean, the list goes on. These are all types of traumas. So let's pretend we're in a jail or prison setting and someone is getting released from that setting and they have an extensive trauma history, and you're looking through the lens of the R&R model. Housing. How do they find housing? Employment, education. How do they manage their money? Do they need to go to substance use treatment? Do they have transportation needs? Are they dealing with high levels of shame? Do they have lack of social support? Are they uninsured? Were they given medications for a few days, but they truly need to see a psychiatrist? Lots of barriers, lots of challenges. Now you throw trauma into the mix. It can impact organizational deficits for people. Maybe they're chronically sleep deprived, and now that's exacerbated memory issues, concentration issues. It's fuel on the fire. Now they are more depressed, more anxious. They're lacking motivation. They're having a real hard time staying motivated, finding a job. Maybe they're also dealing with a co-occurring brain injury, and they're required for part of their probation to get a job, find housing, and maintain it. Can they fill out that application? Can they present competently in an interview? Maybe they can find the job okay, but they really struggle with social interaction deficits, and they have a real hard time with self-regulation concerns in a job setting. All of these factors can absolutely be barriers for the individual. Maybe the person's dealing with chronic body pain issues as a result of a trauma, and that is exacerbating physical pain, and physical pain and mental health go hand in hand. So I think it's important to consider asking clients or screening for any emotional discomfort, any physical discomfort they're dealing with, identify these barriers. Maybe you're working with clients with chronic obesity issues. There's a big connection between extensive trauma histories in childhood and obesity problems in adulthood. Looking at the connection between high ACEs scores and problems with blood sugar regulation issues. Maybe they're more prone for diabetes. So there's a lot of barriers we need to consider. Are they dealing with substance use issues, lower levels of self-control? Maybe they're very impulsive in their thinking. Trauma, untreated trauma, can contribute to impulse control issues, something called emotional lability. Do you have a client where they go from 0 to 60 in a second or two and they're just up and down mood swings? What about their co-occurring psychiatric issues? Again, we want to rule that out. Maybe they have some rage control issues, anger control problems, high levels of irritability. Has anyone dug deep? Could there be trauma that could be driving the bus with some of these things? In some cases, I would say absolutely. I'm never saying 100%. But if we look through that lens of the adverse childhood experiences literature, the ACES research has studied a wide range of antisocial behaviors and has found that people with higher levels of ACES scores may be more likely to be exhibiting externalizing behavioral problems. What does that mean? Externalizing behavioral problems are going to be things that you can probably see or experience. A client who's more aggressive, yelling, screaming, things like that. But we also want to be aware of higher levels of internalizing problems that the person may be dealing with. Those might be things that are more difficult to detect. More loneliness, sadness, they're withdrawn. Maybe they deal with a high level of social anxiety and they're just extremely fearful being in crowds or going to a job interview. Higher levels of ACEs have also been shown in some cases to contribute to earlier contact with the criminal justice system, and in some cases, greater likelihood for life course offending. So, Joe, we can talk about some problematic coping strategies if you'd like as well. We can go a lot deeper. We could talk about risk-taking behaviors, self-regulation problems that are in our model too. You tell me where you'd like me to go.
Keep going where you're going. I'm so glad I asked that question because, again, it sort of dispelled this notion that at best ACEs should be a responsivity consideration, because you were rattling off some criminogenic things there, Jerrod, when you talked about low self-regulation, for example, substance misuse. So, yeah, I think it's important to just keep broadening the lens of which we, which we do our work with our clients.
Yeah, you bet. So, if you're working with clients, they have extensive trauma histories, it's never been addressed, there's going to be a higher likelihood that that person may also engage in problematic coping strategies. So you as the probation officer, you as whatever worker you're doing, if you're recognizing these patterns, referral to another professional may be warranted. And it's not just one person involved. It's probably going to be a team of professionals. I say that because what happens if your client is dealing with psychiatric issues? They may do well with a case manager, a therapist. Maybe they're in need of medications. Maybe a referral to a psychiatrist. Maybe it's a housing worker. Maybe it's a job coach. The list goes on, but we really want to be aware of these problematic coping strategies. Some of the things that come to my mind when we think about like problematic strategies that could bring that client back into the criminal justice system: fear-based approaches. Maybe they have trust issues. Maybe they have a tendency to act out behaviors that are really problematic. Do they disassociate? Maybe they're dealing with psychosis. Do they have a tendency to minimize or deny or blame other people? Do they have a tendency to engage in self-interest behaviors or risk-taking behaviors? Not to throw a wrench into this, but what happens if you're working with clients with neurodevelopmental disorders or individuals that have lower social emotional maturity? I'll give you a great example. Maybe you're supervising someone on probation and they're dealing with some sort of disorder and they function a lot lower than their chronological age. So maybe you have a client who's 30 years old chronologically, but their brain functions as a 15-year-old, a 12-year-old. Are you modifying your goal plan, your sentencing recommendations, your treatment plan, whatever you're doing to match their emotional, cognitive, and developmental age, or are you matching that to their chronological age? If you're matching it to their chronological age, there's a good chance they slip through the cracks. What happens if they're dealing with a learning disability, cognitive impairments? They need extra time to process information. Maybe they're dealing with dyslexia. There's a whole bunch of literature about dyslexia in the criminal justice system. Maybe they're sleep deprived and they just come off as checked out, withdrawn, and lazy, and the professional jumps to that conclusion that that's what's going on, when in fact maybe they're sleep deprived. How resilient is the individual? Promoting resilience is very, very important. Do they have a personal growth mindset and they're able to look to the future, or do they always focus on the moment? If you have a client that always focuses on the moment, that can be very problematic, especially if they're impulsive and maybe they get their paycheck and they blow through their paycheck within a day or two and they don't think kind of cause and effect, thinking to the future. Now they don't have enough money to pay their copay for their meds, pay their bill for their rent bill, their light bill. There's a lot of things we need to help clients with, and a lot of times they're dealing with many different types of challenges.
Again, Jerrod, the more you speak, the more I make those connections to the R&R model. And again, the more I'm grateful that I had you on to talk about this very important issue of ACEs and its overlay and the approaches we take. You talked a little bit earlier about the early, sort of the origin of ACEs research. Has it expanded over the years? Is there an evolution there that you'd like to touch on, perhaps?
Countless studies have been published, expanded on. It's been studied within the context of the criminal justice system, the medical arena. I mean, the list goes on. It looks at poverty. It looks at discrimination, racism, physical health, mental health, attachment, divorce. It is such an important topic. If you're working with people in the helping professions, it is imperative that you seek out training and education in ACEs as well as trauma-informed care approaches, because again, you're probably coming into contact with clients directly or indirectly impacted by trauma on a daily basis.
Talk about, if you would, ACEs in the era of COVID-19.
Done a lot of training lately on COVID-19 through a behavioral health lens, and it is amazing how much research is coming out in the last year and a half that is clearly showing an increase in depression, anxiety, sleep problems, substance misuse, obesity. When we think of COVID, it's a trauma in and of itself. It's almost like a collective trauma where we're all going through it. We're all impacted by COVID in some capacity, some more than others. And I think for some clients, that level and fear and worry and uncertainty is a real challenge. And think of the disruptions it has created for so many people. Work, when people eat, family time, if you're raising kids, playtime, socialization, exercise, sleep time, nap time, the technology use. And if you go through all this literature on COVID that's coming out, what are some of the negative kind of feelings people are having? At the top of the list is going to be that uncertainty. Some clients do not do well with uncertainty. Some people may feel more disconnected from others, family, friends, coworkers, or even themselves. Change, very tough. Some people just feel powerless in this. They just feel like there's no control. Higher levels of anxiety have been reported. Irritability. What happens if someone has lost someone to COVID? They're dealing with grief and loss issues. Maybe they're carrying around a lot of guilt, anxiety. So COVID-related stressors are a real thing. It is having a real negative impact on the individual's behavioral health, physical health. Some of the things that the research is really pointing out: increases in hopelessness. In some cases, it's contributing to rage control issues, lack of motivation. Some people are having excessive fears now, difficulty falling and staying asleep. That's pretty much insomnia. Changes in appetite. Some people are overeating. Some people are not eating. Depression, anxiety. In some cases, it's increasing risk of suicidal thinking and behaviors. Financial issues, job loss, frustration, homelessness, the list goes on. And if now you're working with someone with an extensive trauma history prior to COVID, and now in the era of COVID, that could be an extreme trauma trigger. Now, if we think of this too, if we look at the adversities, what happens if someone is living in an environment where it's not safe to be in that environment, where they're exposed to intimate partner violence? Is it a family on the verge of homelessness? They don't know where they're going to get their next meal from. They don't know how they're going to pay their light bill. They just are dealing with so many challenges and stressors that can absolutely impact their well-being, physical, emotional, behavioral health. When we think of this through a lens of children, if you're working with a family systems component too, children trying to navigate being at home, not seeing their friends as much. This fall, do they go back to school? And if COVID gets worse, are they going to go back online? That change can be very challenging. What happens if it's a parent raising a child with special needs? That adds another layer of challenges and complexities. So we really need to look at this through a family systems lens as well as a trauma lens as well, and helping them promote resilience and getting them supports and services they so desperately need.
We've packed so much good information into this interview, Jerrod. Before I let you go and we give a little teaser as to part 2 of our 3-part series here together, any other major ACEs topics that you'd like to share?
Maybe just talk briefly about toxic stress and complex trauma, because we'll talk about that in our next session. But people with high ACEs scores obviously are going to be dealing with toxic stress. And toxic stress is, think of it more as like intense, frequent, or prolonged adversity. And it can be extremely overwhelming for that impacted individual. And if this goes unchecked and there's no supports or services in place, and this goes on for a long period of time, this can absolutely negatively impact body and brain development for that child and contribute to lifelong implications. Cognition. If you hear me talk about cognition, think of the brain, executive function, learning capabilities. As this child gets into school, this could have an impact on their ability to learn effectively. It could contribute to behavioral problems as that child gets older, disruptive behavioral problems. From kind of a medical lens, it can impact immunity. It could impact growth. And if we look at trauma that's repetitive, think of complex trauma, developmental trauma. That's more wide-ranging, and this can involve a lot of different interpersonal experiences and events. Usually, if it's a young child, it's happening in their family of origin. It's repetitive, it's more prolonged, it can be cumulative, pervasive, it can be even unpredictable and uncontrollable, and it could escalate over time. And if a young child is going through this widespread complex trauma, this can create feelings of helplessness, hopelessness. What happens if that child was exposed to trauma in utero? Mother was using drugs, alcohol. Maybe she was dealing with trauma herself. And now the child is born into an environment where there's trauma going on postnatally. You have prenatal trauma, and now you have postnatal trauma. This can contribute to lifelong neuro, biological, physical, social, psychological deficits. And we also need to be aware when we talk about trauma, complex trauma, issues of like hyperarousal. You might hear it referred to as like fight, flight, freeze responses. And this can absolutely compromise that person's attachment patterns, self-regulation abilities, and just really erode their overall sense of self. But I want to leave people with hope too, because there's a lot of different things we can do. And maybe in one of the upcoming sessions, Joe, we can talk about all the positive things that we can do to help people. But first and foremost, become aware of the ACEs research, trauma-informed care, resilience, getting training in motivational interviewing, strengths-based approaches, attachment-based approaches. If you're working with clients and you really want to help them through a trauma lens, establish safety. If that client doesn't feel safe, it's hard to build a solid kind of foundation on. It's like building a house. If the foundation's cracked, and if you build on there, it's going to crumble in time. Creating safety for that client, stability, predictability is creating a good, solid foundation to build on. Helping that client learn how to self-regulate, very important. Teaching them how to put on the brakes, something called inhibition that falls under the umbrella of executive function. Inhibition is like our internal pause button, our parking brake. If we can help clients learn how to pause and reflect and delay gratification, that is a very, very good thing. You as practitioners, I think engaging in active listening, being attuned, being empathetic, utilizing appropriate forms of communication that is matched to that client's developmental, emotional, and cognitive age is going to be very, very helpful. Helping that client get connected to resources and supports, because maybe they would benefit from cognitive behavioral therapy. Maybe they would benefit from a referral to a art-based therapist, a play therapist. Maybe it's someone who practices mindfulness. Some clients like expressive writing. Some people do very well with animal-assisted interventions. So there's many interventions that have been shown to help people with trauma histories. And we can dig a lot deeper into that in parts 2 and 3, Joe.
Yeah, great segue to part 2, which will be on trauma-informed care. In the meantime, Jerrod, why don't you share with our listeners the great work you're doing at Concordia University, those programs up and including your recently launched graduate certificate program at Concordia.
Yeah, we've been working hard on getting the program ready. My good friend and I, Janina Schick, have been taking the lead on that, and we're going to be launching that next month in September. And it's going to be a fully online program and 3 credit courses, 5 classes in the trauma and self-care and resilience track, 15 credits. We'll be digging a lot deeper into the topics I'm talking about today, as well as many more. We have a class that focuses just on kind of more like child development, the impact that has on the brain. We have one that focuses specifically on the criminal justice system. We have another class that's focused specifically on the helping professional, so teaching like self-care strategies, understanding burnout, vicarious trauma, empathy fatigue. We'll have discussions about attachment-based interventions in there. How does trauma impact people with serious and persistent mental health issues, people with brain injuries, people on the autism spectrum, how it impacts young kids, how it impacts adults. So we're really going to take a deep dive into many important topics related to trauma. And if you're working in the helping professions, it doesn't matter if you're a probation officer, a case manager, a psychologist, you would benefit from this program. It is a non-licensure program. It is a human service-based program, but you will understand the topics of trauma. You will increase your knowledge, your competencies, and your credibility in this area as well.
And it's worth repeating. You mentioned it, but it's worth repeating since I know from my analytics that my listeners are all over the country, if not all over the world, that this is a totally online distance education approach. So folks outside of St. Paul and outside of Minnesota can take advantage of that great program as well. Dr. Brown, I can't thank you enough for your time, and I'm really looking forward to, again, part 2 of this series, which will be on trauma-informed care.
Thank you, Joe, and thank you, everyone. If anyone ever has any questions, I will always respond to emails, and I know Joe is going to probably share my email with everyone. So thank you again for tuning in today.
Thanks, Dr. Brown. Be well.
A quick break from the show to give a shout out to our friends at ACES, the American Institute for the Advancement of Forensic Studies. ACES is a professional organization dedicated to uniting the forensic communities of criminal justice, education, law, medicine, and psychology. ACES is a leader in building relationships within the forensic community, locally and nationally. The mission of the American Institute for the Advancement of Forensic Studies is to provide quality education, training, consultation, and research in the forensic studies to professionals and students. AFIS is a leader in connecting members with one another to help facilitate professional growth, increase competency, and awareness in forensic mental health studies. For details as to upcoming training events, webinars, or publications, please visit them at www.aiafs.com. And now, back to the show.
Clearly, we could have talked so much more with Dr. Brown as to the topic of ACEs, or Adverse Childhood Experiences. I encourage you to reach out to Dr. Brown with additional questions you may have as to this very relevant topic. Or more to the point, check out their programs at Concordia University. I have left a link in the episode show notes along with Dr. Brown's email address. I encourage you to augment your human capital, pursue those educational opportunities if you are so inclined. And be sure to keep an eye out for the second installment of this 3-part series with Dr. Brown as we next address TIC, or trauma-informed care. Hey, speaking of future guests, so thrilled to be able to share with you that next week's scheduled guest is Brad Bogue of JSAT in Boulder, Colorado. JSAT stands for Justice System Assessment and Training, of which Brad is the director and founder of that agency. Brad is an experienced investigator, author, and internationally recognized expert in probation, parole, case management practices. Brad has worked in the fields of corrections, mental health, and alcohol and other drug addiction since 1971, when he started working in a therapeutic community based over in New York. I've known Brad for about 10 years. Trust me, you're not going to want to miss this great interview we've got lined up with Brad Bogue next week. In the meantime, you may contact the show or reach out to us through our website, theparagongroup.llc.com, for training or presentations as to evidence-based practices or implementation, or, of course, the topic of desistance from crime. If you have questions or comments as to this podcast, feel free to contact us through our email of thecriminologistpodcast@gmail.com. That's thecriminologistpodcast@gmail.com. Remember to follow us through our Facebook page and our Instagram pages at The Criminologist Podcast. New fun images are being added all the time to those feeds. You don't want to miss out. The Criminologist Media Group is also on Twitter. You can follow us at Crim Media Group. That's CRIM Media Group. Go ahead and give us a follow. You can also connect with me, Joseph Arvidsson, on LinkedIn, and follow both the Criminologist Podcast and the Paragon Group on our LinkedIn pages. And lastly, if you've not already done so, check out and subscribe to our YouTube channel, The Criminologist, for additional content as to the themes of this podcast. Merchandise is now available. Reach out if interested. And if you believe in what we're doing, if you're part of the movement, please spread the word. Tell a friend or a coworker or a colleague about us. Ask them to subscribe to the show. And of course, do so yourself if you've not already done so. And always remember, folks, there's no them. There's only us.
The Criminologist Podcast is a production of the Paragon Group, LLC. For speaking engagements, interviews, program design, or training opportunities, please visit us at theparagongroup.llc.com. If you enjoyed the show, you can find more content and videos on our YouTube channel, The Criminologist. Don't forget to like and subscribe. Both the Criminologist Podcast and the Criminologist channel are brought to you by the Criminologist Media Group. Be sure to give us a 5-star review, and thanks for listening.
The thoughts, statements, and opinions of the host and cast members do not necessarily reflect the views of their employers and are those of the host and cast themselves. Any discussion regarding client statements, behaviors, actions, or crimes are purely fictional and are used only for the purposes of example. Any examples that could be deemed to be related to an actual individual or individuals are incidental.